So next is oxygen delivery. How is oxygen delivered to the patient? Oxygen delivered to the lung depends on the patent airway concentration of oxygen and adequate ventilation. There are two key methods of delivery: variable devices and fixed performance devices. Variable are two: nasal cannula and face mask. Nasal cannula can give 2 to 4 liters per minute and it may dry the nasal mucosa, cause discomfort. And face mask, simple Hudson mask to avoid the rebreathing, administer flow rates of more than 5 liters per minute. So fixed performance devices, so they give consistent FiO2 ratio. Number one is Venturi mask. It can give, it has the 3 colors mentioned here: blue, yellow and green. And non-rebreather mask, which give FiO2 close to 0.7 to 0.8, mostly used in trauma. Non-rebreather mask, NRM, non-rebreather mask with reservoir bag. And high flow nasal cannula and continuous CPAP, continuous positive airway pressure. And then non-invasive ventilation. It's similar to CPAP with the addition of inspiratory pressure support, which further reduces the work of breathing. Then invasive ventilator support after intubation. What is a Venturi valve connector? This can deliver a relatively constant FiO2. The nozzle on the mask is designed to entrain air with oxygen. It delivers a specific FiO2 depending on the nozzle used. It is essential when using Venturi connectors to ensure that the oxygen flow rate is set to that printed on the valve. It relies on the Venturi effect, an example of Bernoulli's principle. This encourages the air to how does a reservoir bag increases the FiO2 given to a patient? Using a non-rebreather face mask, the reservoir bag delivers the highest oxygen concentration possible on general wards. The flow of oxygen from the oxygen source cannot match the patient's inspiratory flow. So with each breath, air is entrained around the sides of the mask and through the holes in it. When a close-fitting mask with a reservoir bag is used, on each inspiration, 100% oxygen from the reservoir bag supplement oxygen delivered via the flow meter, increasing the FiO2. And despite this, a reservoir bag can still produce only around 60 to 70% FiO2 as a result of air leaks around the mask. What is high flow nasal oxygen therapy? High flow nasal oxygen therapy is delivery of warm, humidified medical gas at flow rate of 60 liters per minute. This requires an oxygen air blender, active humidification and warmer. The FiO2 is set from 0.21 to 1 in a flow up to 60 liters per minute. What is a transanal humidified rapid insufflation ventilator exchange? Thrive. Transnasal humidified rapid insufflation ventilator exchange Thrive. The technique that uses rapidly insufflated heated humidified gases administered by high flow nasal cannula and is becoming popular. What are the potential complications of oxygen therapy? Number one is absorption atelectasis, and this happens, nitrogen is slowly absorbed, which splints the alveoli. A high oxygen concentration flush out the nitrogen and oxygen is absorbed rapidly, causing the alveoli to collapse. This is called absorption atelectasis. Number two, pulmonary toxicity. Oxygen can irritate the mucosa of the airways directly, leading to the loss of surfactant and progressive fibrosis. Absorption atelectasis, pulmonary toxicity, and then hypercapnia. In patients with chronic type 2 respiratory failure, this can be avoided by titrating oxygen therapy to saturation of 88 to 92%. That's why in COPD, our oxygen target is 88 to 92%. Retinopathy is due to the retrolenticular fibroplasia in premature infant, and there is a risk of fire and explosion with the oxygen. Last, what is an end-tidal carbon dioxide monitoring face mask? So end-tidal carbon dioxide phase monitoring face mask is a conventional variable concentration oxygen mask with a gas sampling port. This port allows the sampling of the exhaled carbon dioxide from the mouth and nose in non-intubated patients while supplementary oxygen is administered. This allows monitoring of respiratory rate and ventilation, which is particularly useful if sedatives are administered. Thank you.